Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 118. A 30-year-old man was brought to the neurosurgical department with complaints of constant headaches, nausea, vomiting, fever, and weakness of the right side limbs. Anamnesis states that 1 month ago, the patient had a surgery for left-sided suppurative otitis and mastoiditis. He has been undergoing treatment in an ENT department. Approximately 2 weeks ago the temperature increased, and the patient developed headaches. Objectively, heart rate 98 per minute, BP 140/90ths of a millimeter Hg, temperature 38.3 degrees C. Neurologically manifested stiff neck. Bilateral Kernig's symptom, unsteadiness during the Romberg's maneuver. Computer tomography of the brain revealed a 3-dimensional growth with a capsule in the left hemisphere. Make the diagnosis. A. Hemorrhage. B. Echinococcus. C. Hydrocephalus. D. Cerebral abscess. E. Arnold-Chiari Malformation. Cerebral abscess, brain abscess, is most commonly caused by an infection of bacteria, fungi, or a parasite. They can infect a part of the brain and cause swelling. Infected brain cells, white blood cells, live and dead fungi, bacteria, and parasites all accumulate there. As the swelling grows, it puts increasing pressure on brain tissue, leading to destruction. Symptoms: headache, fever, nausea and vomiting, seizures. Kernig's sign is a test used in physical examination to diagnose meningitis and subarachnoid hemorrhage. Procedure: 1. The patient is positioned in supine with hip and knee flexed to 90 degrees. 2. The knee is then slowly extended by the examiner. 3. Resistance or pain and the inability to extend the patient's knee beyond 135 degrees because of pain. 4. Repeat on the other leg. The positive sign is shown when the patient claims for the pain. Romberg's test is a test used to check neurological function for balance, driving under the influence of an intoxicant, alcohol or drug, and neurological decompression sickness. In the test, the standing person is asked to close one's eyes. An increased loss of balance is the positive sign. Unknown. A tendency to sway and fall that is already evident with eyes open is suggestive of dizziness of vestibular or cerebellar origin. Positive. A tendency to sway and fall with eyes closed is suggestive of a spinal disorder, e.g., polyneuropathy. Chiari malformation is a structural defect in the cerebellum, characterized by a downward displacement of one or both cerebellar tonsils through the foramen magnum. This can sometimes lead to non-communicating hydrocephalus as a result of obstruction of cerebrospinal fluid outflow. Hydrocephalus is an abnormal buildup of cerebrospinal fluid in the ventricles that causes the ventricles to widen, putting pressure on the brain's tissues. Brain Echinaccocosis, cerebral Hydatid cyst, is the most common brain parasitic infection in the world. It is more common, more than half, in pediatric population and young adults with a male predominance. The definite hosts of Echinococcus are various carnivores. The growth of the cysts is usually slow and asymptomatic, and clinical manifestations are caused by compression of the involved organ. Computer tomography shows Hydatid cyst as a spherical, well-defined, thin-walled, homogeneous, and non-enhancing cystic lesion without peripheral edema. The answer is D. Cerebral abscess.